Hello, my name is Lucia Ceballos, and today we're going to talk about effects of vaccination on invasive pneumococcal disease in South Africa. Definition. Streptococcus pneumoniae can cause invasive and non-invasive disease under the denomination of invasive pneumococcal disease. Those infections that are located in tissues, organs, and fluids that are normally sterile and that are associated with generally several clinic processes are included. In South Africa, a 7-valent pneumococcal conjugate vaccine was introduced in 2009 with a 3-dose schedule for infants at 6, 14, and 36 weeks of age. A 13-valent vaccine replaces the 7-valent pneumococcal conjugate vaccine in 2011.
Pneumococcal is a bug that causes a range of infections, from ear infections through to pneumonia, as the commonest cause of pneumonia worldwide, through to what we call invasive pneumococcal disease, which we really worry about, which is really bloodstream infections and meningitis. Invasive pneumococcal disease is where the bug gets into the bloodstream or causes meningitis, an infection of the lining of the brain. And those are really the most feared infections caused by this bug. And with meningitis particularly, around 1 in 4 children who get the infection will be left with some permanent damage from it, either hearing loss causing deafness or some sort of delays to their development caused by brain damage from meningitis itself. And that really is the reason why vaccination is so important against this bug.
Application in medicine. The majority of deaths associated with childhood pneumococcal disease occur in Africa. Its randomized trial conducted in African pneumococcal conjugate vaccine was given to infants when they were 6, 10, and 14 weeks of age without booster dose. The vaccine showed efficacy for the prevention of invasive pneumococcal disease caused by the 9 serotypes contained in the vaccine among infants that were not infected with the human immunodeficiency virus and among infants who were infected with HIV. In 2009, South Africa became the first African country to incorporate vaccination in a pneumococcal conjugate vaccine in the routine infant immunization program. The 7-valent pneumococcal conjugate vaccine was introduced with the use of the novel 3-doses schedule with 2 primary doses given to infants at 6 and 14 weeks of age, and a booster given at the 9 months of age. In April 2011, a 30-valent pneumococcal conjugate vaccine replaced the 7-valent pneumococcal conjugate vaccine.
I'm a pneumococcal germ, but please, call me Pneumo. I'm a germ with a dangerous reputation. I mean, come on. You don't make 4 million children and adults sick each year by being nice.
Vaccines are your best shot against pneumococcal disease. What is pneumococcal disease? It's caused by a common type of germ. When someone with a disease coughs or sneezes, the germs can spread to other people. Most of the time, people who get pneumococcal disease only have mild symptoms, but sometimes the germs can cause serious problems like ear, lung, blood, or brain infections. Some of these infections can make people very sick and may lead to hospitalization, months of recovery, and even death. Pneumococcal vaccines are the best way to protect yourself from these germs and the diseases they cause. Who needs to get vaccinated? Everyone does at some point. It's especially important for babies and people aged 65 and older, as well as people with a weakened immune system, like a person with kidney failure, cancer, HIV, or an organ transplant, or an ongoing health condition like heart disease, diabetes, asthma, smoking, and alcoholism. Pneumococcal vaccines are very safe, but like any medicine, they can have side effects. Common side effects include a sore arm where you got the shot, or a fever, and they go away in a few days. How do I get vaccinated? It's easy. You can usually get the shots at your doctor's office or local pharmacy, and vaccination is covered by most insurance plans. If you're a parent, pneumococcal shots are already part of your child's regular vaccination schedule. Okay, let's recap. Pneumococcal disease can cause serious infections of the ears, lungs, blood, and brain. So babies, adults over 65, and people with weakened immune systems or ongoing health conditions need the pneumococcal vaccines. They're covered by most insurance plans and available at your doctor's office or pharmacy. Vaccination is your best shot at keeping you and your loved ones safe from certain infectious diseases.
Pros and cons. The direct and indirect benefits of the 7-valent pneumococcal conjugate vaccine, the reduction in disease among young children who received the vaccine and among older children and adults, respectively, have been seen in many high-income countries. Most antibiotic-resistant pneumococci are of the serotype contained in the pneumococcal conjugate vaccines. Thus, reduction in rates of antibiotic-resistant invasive pneumococcal disease are seen after the introduction of the pneumococcal conjugate vaccine. Cons. Children in African countries, however, have higher rates of pneumococcal disease and serotype carriage than children in other countries. Therefore, the benefits of pneumococcal conjugate vaccines may be different. In addition, indifferent effects may be attributed among persons in African countries who have coexisting disease, such as HIV infection.
The information we're sharing today really is important for clinicians because we are basically providing them with information that shows that we have studied the different populations that we may be seeing in the office. And so whether you are a pediatrician seeing the babies and trying to reassure parents, whether you are a gerontologist who would like to reassure all the patients, and where you have conditions that are maybe now also associated with COVID-19, are the same conditions that are also at increased risk for pneumococcal disease. Or whether you have a physician that is dealing with people with diabetes that's really increasing, or chronic heart and chronic lung disease, or you are somebody from the Native American population. Our program is so broad that it's providing data on all those populations. So you'll see that our vaccine really can induce immune response and be safe. So they can use that in those populations. I will also say that with our vaccine program, we were guided by principle of science, like many of the things that we do at work. And the science meant that we're not really rushing through delivering a vaccine that is can be licensed, but making a vaccine that could make a difference in people's life. And so that is what is guiding us. Always think about the customer and the patient first. And then last but not the least, I think that the developing vaccines is a long, long effort. There are a lot of people within the organization and parents and individuals in the population who are enrolled in our studies that help us develop the vaccine. So I want to thank those volunteers that really were part of our clinical studies. We also want to thank the physicians who helped us in conducting those studies. We had a great conversation with the regulators from different countries that really helped us shape the program. And last but not the least, I want to thank all my colleagues from Merck for really supporting this program
and really spending hours and hours, despite challenges due to either personal issues or COVID-19, to really make sure that we advance this vaccine and we offer something different to the populations and to the physicians.
Application in Ecuador. The pneumococcal vaccine has shown positive effects in the Ecuadorian health system by significantly reducing hospitalization and mortality for pneumonia in children under 5 years of age. In 2011, the immunization schedule was modified, giving away to the use of the decavalent pneumococcal conjugate vaccine, which is maintained on these days. Conclusion. Once again, we show the importance of vaccines in our society. In this case, rates of invasive pneumococcal disease among children in South Africa fell substantially by 2012. Reduction in the rate of disease caused by the 7-valent pneumococcal conjugate vaccine serotype among both children and adults most likely reflect the direct and indirect effect of vaccination. Thank you.